Good day, everyone. Today, I am here to present Chapter 3 entitled Exceptional Development. Okay, let's start on the objectives. The students are able to identify the categories of exceptional development in children with special needs. For the second one is find out the characteristics and the biological and environmental causes of these exceptionalities. For the third one is explain the importance of basic sign language. For the physical disability, the physically handicapped have impairments that are temporary or permanent, such as paralysis, stiffness, or lack of motor coordination of bones, muscle, or joints, so that they need special equipment or help in moving out. Sabi dito, ang physical na kapansanan ay isang kondisyon na nakakapekto sa mobilidad, paggalaw o lakas na iba pang aspeto ng paggana ng motor skills ng isang tao. For the crippling disabilities, include the following. Ito naman ay isang halimbawa ng pagkakaroon ng kapansanan ng isang tao. For the first one is impairment of the bone and muscle system, which affect mobility and manual dexterity, difficult and impossible as in the case of the amputees and those with severe fractures. For the second one is impairment of the nerve and muscle system, making mobility awkward and uncoordinated as in cerebral palsy and deformities of absence of body organs and system for mobility, like in the case of the club foot and paralysis. These are three factors that are cause of handicap, and this is the first for prenatal factors. These are factors that affect normal development before and after conception, virtually lasting up to the first trimester or the third trimester of life. For the prenatal risk factors, include chronic maternal illness, certain maternal infections, toxin exposures, and nutritional deficiencies. Risk factors in the perinatal period include pregnancy-related complications, prematurity and low birth weight, and infections exposure during pregnancy or at time of birth. Sa prenatal factors, nakapaloob ang first, genetic or chromosal aberrations. Ito ay isang resulta ng isang pagkakatugma ng dugo ng mag-asawa, kaya naman once na nagsama ang genes ng ama at ina, naapektuhan ang kanilang supling. For the second is prematurity. When a baby is born too early, before 37 weeks of pregnancy have been completed. The earlier of a baby is born, the higher the risk of death or serious disability. For the third is infections. Ito ay isang sanhi ng bakterya o virus sa fetus habang nasa sinapupunan ng kanyang ina. Ang mikrobyo ng karaniwan nagmula sa mga sakit na lubhang nakakahawa, kaya pati ang fetus sa sinapupunan ay nagkakaroon ng mikrobyo galing sa kanyang ina. For the fourth is malnutrition. Nangyayari ito kapag hindi sapat ang pagkain ng masustansyang pagkain ng ina or ng nanay. Kaya naman naapektuhan ang bata o fetus sa kanyang sinapupunan. For number 5 is irradiation. Exposure is especially concerning in children. For one thing, children are more sensitive to radiation than adults because their body are still growing. For children might also receive a higher radiation dose than necessary if equipment settings are not adjusted for their smaller body size. For 6 is drug abuse. Ang paggamit ng drugs ng isang ina ay pinagbabawal na gamot ay nakakapekto sa fetus at ang thalidomide na ginagamit ng mga ina ay nakakaapekto sa mga sanggol, kaya ipinapanganak ang mga bata na walang paa at kamay. Ang thalidomide naman ay isang drugs na idinevelop noong 1950s. For the prenatal factors, the prenatal period is the time immediately before and after birth. Disabilities originating from this time period are primarily biomedical ones. They may result from prematurity, injury, oxygen deprivation, or infection acquired during the trip through the birth canal. Okay, these are three factors that cause crippling and conditions during the period of birth. First one is birth injuries. Birth injury is defined as an impairment of the neonate's body function or structure due to an adverse event that occurred at birth. Injury occurred during labor, delivery, or after delivery, especially in neonates who require resuscitation in the delivery room. For the second is dystoxia of labor, or defined as difficult labor. Ito yung tinatawag na mabagal na proseso ng paglalabor ng isang babae o ng isang ina. For the hemorrhage, ito ay labis na pagdurugo ng isang ina sa panahon ng panganganak na maaring sanhi ng pinsala ng matres. For the postnatal factor is a developmental pediatrician review all abstracted information to determine whether children had disability with a postnatal cause. A postnatal cause was defined as any event that occurred from age 30 days through 10 years. Okay, these are causing crippling condition after birth. For the first one is infection. Ito ay isang sanhi ng sakit tulad ng diphtheria, typhus, meningitis, encephalomyelitis, at rickets sa mga sanggol. For the second is tumor and abscess in the brain. Sinisira nila ang mga selula ng utak na konektado sa paggalaw, kaya nakakapinsala sa mobility ng isang bata. For the third is tuberculosis of the bones. Ang isang ina na may tuberculosis ay nakakaapekto sa kanilang mga anak na nasa sinapupunan. Dahil may mikrobyong dala ang sakit na ito para sa mga bata, kaya naman ang kanilang pinapanganak ay nagkakaroon ng kondisyon na pagkabaldado. Okay. 4. Cerebrovascular inquiries. Ito ay isang injuries sa ulo na nagiging sanhi ng pagkawala ng isipan ng mga bata sa mga bagay or mga batang tinatawag na late develop. 5. Fractures and dislocations. It's usually caused by a sudden impact from a blow, fall, or other trauma. You can dislocate almost any joint in your body, your ankles, knees, shoulders, hips, elbows, or jaw. You can even dislocate your finger and toe joints. When more pressure is put on a bone than it can stand, the bone may split or break. For the sixth is post-seizure or post-surgical. Ito ay isang konvulsyon pagkatapos ng panganganak na nagdudulot ng pagkabaldado ng isang ina. For number 7 is arthritis. Arthritis rheumatism. Ito ay sakit na nakakaapekto sa spinal column at nararamdaman ito sa mga kalamnan tulad ng mga magulang. Nakakaramdam sila ng pagkasakit ng kanilang joints. Kaya naman namamaga ito at based on my research, ang mga kababaihan ay mas prone sa sakit na rheuma at nakukuha ito kapag naninigarilyo sa edad na 40 to 60 years old na tao. Sila ay nakakaramdam ng rheuma. For the next one is sensory impairments. Sensory impairment is when one of your senses, sight, hearing, smell, touch, taste, and spatial awareness is no longer normal. Where the sensory impairment is the common term used to describe deafness, blindness, visual impairments, hearing impairments, and deaf blindness. Visual impairment is a term exerts used to describe any kind of visions loss, whether it's someone who cannot see at all or someone who has partial vision loss. Some people are completely blind, but many others have what's called legal blindness. Ito yung mga taong hindi na kayang solusyonan ng salamin or contact lens ang mga mata. For blindness is a lack of vision. It may also refer to a loss of vision that cannot be corrected with glasses or contact lenses. Partial blindness means you have very limited visions. Complete blindness means you cannot see anything and do not see light. Ito naman yung mga taong pinanganak ng walang paningin, kaya naman ultimo magulang nila ay hindi na nila nakikita. Or kaya nasasalat lang nila. The most common visual problems which confront students are visual acuity problems. They are as follows. For number 1 is reduced visual acuity. Poor sight daw sila. Then, walang nakikita. For the amblyopia, lazy eye. For the third is hypertrophy. Yun naman yung mga tinatawag natin na farsightedness. For the fourth is myopia. Nearsightedness naman sila. For the fifth is astigmatism. Ito yung mga imperfect vision. Ito naman ang ginagamit ng mga may disability na alphabet para makasunod sila sa ating mga kaalaman at para malaman nila ito. Kinakapa nila ang mga dots at tinatandaan nila ito para malaman nila kung anong letra ang kanilang hahawakan. Katulad ng A, hahawakan lamang nila ang dots sa bawat isa. Okay? Ayan. A, B, C, D, E, F, G. Yan. Diyan lang nila nalalaman kung anong letra or letter ba yung sinasalat nila. Then, yun yung ginagamit nila para makasunod sa mga taong hindi or alang disability. Tumubo naman tayo sa auditory. Auditory's hearing impairment is the inability of an individual to hear sounds adequately. This may due to improper development, damage, or disease to any part of the hearing mechanisms. Hearing is a prerequisite for the development of normal speech and language. The first one is prelingually deaf child is one who is either born deaf or who lost his or her hearing early in childhood before acquiring language. A child with subnormal hearing acuity suffers from consequences of hearing loss, compounded by impaired speech development. For the second is postlingual deafness. Can be caused by genetic disorders, injury, medication, noise, illness, and birth complications. Genetic disorders are inherited conditions that we are born with. Sa postlingual, dito unti-unti nawawala ang pandinig ng isang tao. Halimbawa, sa matatanda, habang sila ay tumatanda, nawawala o humihina ang kanilang pandinig. Samantalang sa prelingual naman, habang ang bata ay lumalaki, nade-develop ang kaisipan, ang kanilang pandinig ay wala na talaga. For the cause, excess of deafness is a condition. Prenatal causes is the prenatal occurring or existing before birth. Prenatal care is the regular health care women should receive from an obstetrician or midwife during pregnancy. Prenatal development is the growth of a single-celled zygote formed by the combination of a sperm and an egg into a baby. Doon naman sa prenatal causes, the prenatal period is the time immediately before and after birth. Disabilities originating from this time period are primarily biomedical ones. They may result from prematurity, injury, oxygen deprivations, or infections acquired during the trip through the birth canal. Sa postnatal causes naman, a developmental pediatrician view all abstracted information to determine whether children had a disability with the postnatal cause. A postnatal cause was defined as any events that occurred from 30 days through 10 years. Or this is the classification of hearing impaired children. According to age at onset of deafness, congenitally deaf, those born deaf. For the 22, adventitiously deaf, those born with normal hearing but became deaf due to accident or illness. Commonly, most adults begin to lose their hearing around the age of 65. Depending on certain factors, these numbers moves around a little. Some of the more common factors for hearing loss include smoking. Smokers have been found to experience more hearing loss than non-smokers. For the number 2, according to language development, prelingual deaf is those born deaf but lost hearing before speech develop. For the language development supports many other aspects of development, like cognitive, social, and literacy development. Language development starts with sounds and gestures, then words and sentences. You can support language development by talking a lot with your child and responding when your child communicates. For the number 3, according to Flays-Off impairments, conducive to hearing loss, impaired hearing due to interference in sound transmissions through sense organ, in particular in the outer or middle ear. For the sensory neutral hearing loss, impairments due to the abnormal inner ear or auditory nerve or VOT. For mixed hearing loss, a combination of the conductive and sensory neural hearing loss, this is sometimes called a flat loss as depicted in the audiogram. Ito ay ayon sa lugar ng katawan ng kapansanan ng isang tao. For the number 4 is according to the degree of hearing loss is sight, mild, moderate, severe, or profound. According to the degree of hearing loss, you may find out that your hearing loss is more severe. This description is referred to as the degree of hearing loss. It is based on how loud sounds need to be for you to hear them. Decibels or describes loudness.